All right, so there is a national outpouring of support for America's doctors and nurses, but sometimes that's not enough. Joining us to talk about the mental health challenges facing first responders, Chair of Psychiatry and Psychiatrist-in-Chief of New York Presbyterian Hospital, Columbia University Medical Center, Dr. Jeffrey Lieberman. He is a past president of the American Psychiatric Association and was a colleague of Dr. Lorna Breen, a frontline worker at New York Presbyterian Allen Hospital, who took her own life on Sunday. Dr. Lieberman, thank you so much for coming on the show this morning. I'm so sorry about the loss of your colleague. Does this story surprise you? Are there any warnings that we can take away from it as you were taking a look at the mental wear and tear, the challenges on the front lines?
It shocked me, but I can't say it surprised me. When in mid-March, the epidemic began to really escalate, and by escalate, it went in mid-March, there were 100 patients with COVID in the New York Presbyterian Hospital system. By mid-April, it was over 2,000. So you had this torrent of patients inundating the emergency room in addition to all the other cases they have to deal with. So it became apparent to the psychiatrists, who aren't really in the direct line of fire like the ICU doctors, like the medical, the ED doctors, that there was going to be a huge emotional toll if this continued to go on for very long. And so we knew that this was going to affect people in different ways, and we actually developed an action plan to be able to minister to our colleagues, not to treat them, but to provide stress management and professional support. And unfortunately, while we anticipated some mental disorders and some catastrophic developments, we didn't expect it to happen so quickly and to one of our most beloved colleagues.
Dr. Lieberman, it's Willie Geist. We appreciate your time this morning. The tragic story of Dr. Breen, which just breaks your heart, and her father has asked that we remember her as a hero, and we do, of course, for the work that she did, shines a light on something we've been worried about. We all have friends, if we live in the New York area or you live anywhere where doctors are rushing into hospitals right now to treat patients, about the long-term impacts on the doctors and the nurses and the medical personnel, because in some ways it is like a war zone. They don't have time to stop and consider their feelings or what they're going through, but there is trauma for them as well. So how do you keep an eye on those doctors and nurses in the middle of this storm? How do you stop and say to each one, how are you doing? Are you okay?
Traditionally, it's not done. I mean, you don't have emergencies or disasters that deal with that often, thank God. But we know from past experience, looking at the effects from the Great Depression, from the 9/11 disaster, from Hurricane Sandy, that after the natural or man-made or human-made disaster occurs, the aftermath, the consequences are psychiatric or psychological or emotional. And so given the magnitude of this pandemic and the fact that it is lasting so long, we know that the second wave of this, beyond when the contagion is wrestled to the ground, that the major sequelae, major consequences are going to be psychiatric in nature. And that's because it's not just the fear and the stress of social isolation and fear of getting infected, but it's going to be the economic and social dislocation, which is going to be with us for a long time to come.
Mike Barnicle.
Doctor, what we're going through now and what medical personnel are going through now in every certainly big city hospital in the country, as well as rural hospitals, is not exactly like a sudden gunshot wound on a Friday night in the emergency room. This is a wave of similar cases, the virus, a wave. How much of a factor in creating this assemblage of people who now have, I think, PTSD, how much of a factor is the fact that there was very little warning from the federal government during most of January and most of February about what was about to happen to the hospitals, to the nurses, to the doctors?
That was a very large part, if not all of it. So this disease is something that infectious disease medicine has dealt with historically. There have been waves of infectious pathogens: Spanish flu, polio, Asian flu, Hong Kong flu, HIV, SARS, swine flu, MRSA, Ebola, Zika. What caught us unprepared was the rapidity and the magnitude which overwhelmed the system. Doctors are trained to withstand tremendous stress and to see terrible things and carnage. But when you see it in such massive doses, the number of people that were pouring into the emergency rooms that Dr. Breen had to deal with increased by tenfold. And she was not just dealing with huge numbers of patients who were very sick, but she also was witnessing people die in the emergency room or even when they're getting out of the ambulance. And so it was like being in a field hospital during a war zone. And it's the scale of the epidemic as well as the unpreparedness. Think of it this way. It's like in Pearl Harbor, we were caught by surprise. Everybody was shocked and the country had to scramble to deal with it. Same thing with 9/11. That's what we're doing now. And Dr. Breen, as well as many other physicians, when you're trained to be a physician, you become very disciplined, you develop resilience, and you're strong and talented. But everybody's got a breaking point, and we have to be prepared to support the people if they reach that breaking point.
Chair of Psychiatry and Psychiatrist in Chief at New York Presbyterian Hospital, Columbia University Medical Center, Dr. Jeffrey Lieberman, thank you so much. And coming up, the coronavirus outbreak hits a grim milestone in terms of the number of cases and deaths. Plus, Donald Trump or Joe Biden, new polling shows which candidate voters prefer to handle the pandemic and the economy. Morning Joe is back in a moment.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.